October 2025 at Pediatric Critical Care Medicine. In the next few minutes, I'll tell you about the content and help you navigate in your reading. There are 3 feature articles, 4 other clinicals, a PCCM trial, a PCCM conference report, my editor's notes, 2 research letters, and an in memoriam piece. The feature articles. Gertzman et al. Present a single-center cost analysis of implementing the Rehabilitation Bundle A to F 2018 to 2020, and there's an accompanying editorial by Toomey and Hennigan. The second report comes from Murray et al., single-center QI to reduce VTE in the PICU 2020 to 2023, and there's an editorial by Robert Parker. And the third feature is by Tucci et al. 4 PICUs carried out a multicenter EHR-enabled randomized controlled trial on RBC transfusion 2020 to 2022. The 4 clinicals. Butragueño, Lalesca et al. Looked at 3 EU or European Union PICUs with a 28-day point prevalence study in 2023 of red blood cell transfusion. Go et al. Looked at 21 PICUs in Asia 2017 to 2023 and focused on PARDS cases, 625, with a particular focus on nutrition and mechanical ventilation in these cases. Maeda et al. Looked at a single-center prospective mixed method study 2022 to 2023, 159 cases, and the focus was on families at the bedside and in particular the impact of race and insurance. And finally, in the clinicals, O'Halloran et al. Describe a single-center program of work 2021 to 2024, pre-post element in there, and the focus was on a cardiac arrest, ventilation rate, metronome, and this brings together human factors research, implementation science, and engineering science. The 2 research letters, Shatanko et al. Look at BMP in the first 72 hours of critical illness. Utsumi and Shine look at moderate TBI in Japan 2019 to 2024. The PCCM trial protocol comes from Johnson et al., and this is about the recently funded BAC-B study, which is breathing assistance in children with bronchiolitis. Just as an aside, this comes from the same group that had the first ABC studies. The PCCM conference report comes from Derwin et al. 8 programs in the US have formed a pediatric outcomes after PICU subgroup of Polizzi, and the centers describe their programs. My PCCM notes looks at new research on delirium since the publication of the 2022 Pandem guidance. And last, there's an in memoriam piece by Gelbert et al. About Professor Rinaldo Bellomo. So all in all, lots to read, lots to enjoy. Thank you very much, and I'll see you next month.